Hello everyone, today we're diving into a serious topic, cancer. We'll be discussing 10 warning signs of cancer that you absolutely shouldn't ignore. Remember, early detection is key when it comes to cancer. The sooner it's caught, the better the chances of successful treatment. If you're experiencing any of the symptoms we discussed today, please consult with a healthcare professional. Let's jump right in and empower ourselves with the knowledge to take control of our health. Have you ever stepped on the scale and been surprised by sudden weight loss, even though you haven't made any major changes to your diet or exercise routine? Unexplained weight loss can sometimes be an early warning sign of cancer. Cancer cells require a lot of energy to grow and spread, hijacking your body's metabolism. Certain types of cancer, such as pancreatic, stomach, esophageal, and lung cancer, are more commonly associated with unexplained weight loss. This symptom alone doesn't automatically mean you have cancer. Talk to your doctor to investigate the underlying cause of your weight loss. We all feel tired from time to time, but persistent fatigue can be a warning sign of something more serious, like cancer. Persistent fatigue is like having your battery constantly drained, no matter how much sleep you get. You might find it hard to concentrate, and even simple tasks can feel overwhelming. Cancer-related fatigue can be caused by the cancer itself, treatments, or the body's natural response to the disease. Don't brush off persistent fatigue as simply being too busy or stressed out. Your body is trying to tell you something, and it's important to listen. Talk to your doctor about your symptoms. Pain is our body's way of signaling that something is wrong. But when pain becomes persistent, lasting for weeks or even months, it's essential to take it seriously. Persistent pain that could be a warning sign of cancer often has certain characteristics. It might be new, constant, or severe, and interfere with your daily life. The location and type of pain can also provide clues. For example, persistent headaches could be a sign of a brain tumor, and bone pain could be a sign of bone cancer. Not all persistent pain is caused by cancer, but early detection is key. The sooner it's caught, the better the chances of successful treatment. Our skin is the largest organ in our body, and it's constantly renewing itself. This process helps to keep our skin healthy and resilient, shedding old cells and generating new ones. However, not all changes in our skin are part of this natural renewal process. Certain skin changes can be a warning sign of something more serious, like skin cancer. It's important to be aware of what to look for, as early detection can make a significant difference in treatment outcomes. Pay attention to any new or unusual growths on your skin. These can appear as moles, lumps, or patches that look different from the rest of your skin. They might be raised, flat, or have an irregular border. If you notice a new growth, have it checked out by a dermatologist, especially if it's growing rapidly, changing shape or color, bleeding or itching. Dermatologists are trained to identify and diagnose skin conditions, and they can perform a biopsy if necessary. Another red flag is a sore that doesn't heal or heals very slowly. This could be a sign of an underlying issue that needs medical attention. Non-healing sores can sometimes be mistaken for minor injuries, but if they persist, it's crucial to get them evaluated. Changes in the color or texture of your skin can also be a warning sign. Look for areas that become darker, redder, or develop a rough or scaly texture. These changes can occur anywhere on your body, so it's important to check all areas, including those not exposed to the sun. Early detection is crucial when it comes to skin cancer. Regular skin checks can help you catch changes early when they are most treatable. Skin cancer screenings by a professional can provide peace of mind and ensure any suspicious areas are thoroughly examined. Be vigilant about checking your skin regularly for any changes. Make it a habit to examine your skin from head to toe at least once a month. Use a mirror for hard-to-see areas, and don't hesitate to ask for help from a partner or friend. Your vigilance can make a significant difference in your skin health. Unusual bleeding or discharge can definitely raise a red flag. This could include bleeding between periods, heavier or longer periods, or bleeding after menopause. It could also involve blood in your urine, stool, or coughing up blood. Changes in the amount, color, consistency, or odor of discharge can sometimes be a sign of an underlying issue. For example, unusual vaginal discharge could be a sign of a yeast infection or a sexually transmitted infection. Bloody or brown discharge after menopause could be a sign of endometrial cancer. It's always better to err on the side of caution and get checked out by a healthcare professional. Early detection and diagnosis are crucial. We've all experienced the occasional cough or sore throat. But when a cough lingers for weeks or months, or when hoarseness becomes a regular visitor, it's time to listen to your body. These symptoms can sometimes be early warning signs of cancer, particularly lung, throat, or head and neck cancer. If you've had a cough that's lasted for more than 3 weeks, see your doctor. Hoarseness lasting more than 2 weeks should also be checked out. Early detection is key when it comes to cancer. Don't ignore a persistent cough or hoarseness. Talk to your doctor about your symptoms. Changes in our bowel or bladder habits can sometimes be a sign of something more serious, like cancer. It's important to be aware of what is normal for you, and to notice any deviations from your usual patterns. Pay attention to any persistent changes in your bowel movements, such as diarrhea, constipation, or a change in the consistency of your stool. These changes can be indicators of underlying health issues, including infections, inflammatory conditions, or even malignancies. Blood in your stool is another red flag that should never be ignored. It can be a sign of hemorrhoids, but it could also indicate more serious conditions like colorectal cancer or gastrointestinal bleeding. Changes in your urinary habits, such as increased frequency, urgency, or blood in your urine, could be a sign of a urinary tract infection or bladder cancer. These symptoms might also be related to kidney stones or other renal issues. If these symptoms persist despite treatment, see your doctor. Early detection and intervention can make a significant difference in outcomes, so don't hesitate to seek medical advice. Our bodies are constantly giving us clues about our health. By paying close attention to these signals, we can catch potential problems early and address them before they become more serious. Don't ignore changes in your bowel or bladder habits. Discomfort or pain in the abdominal area can also be a sign that something isn't right. Talk to your doctor about your symptoms. Open communication with your healthcare provider is key to maintaining your health and well-being. They can help you determine the cause of your symptoms and recommend appropriate treatment options. Lumps or thickening under the skin can definitely raise a red flag. It's a signal from your body that something might be amiss. While many lumps and bumps are completely harmless, some can be a sign of something more serious, like cancer. It's important to understand the characteristics of these lumps to differentiate between benign and potentially dangerous ones. Lumps that are more likely to be cancerous tend to be hard, painless, and fixed in place. They don't move around easily under the skin and can feel quite different from softer, more mobile, benign lumps. They may also grow quickly or change in size or shape over a short period of time. This rapid growth is often a cause for concern and warrants immediate medical attention. Lumps in certain areas of the body, such as the breast, testicles, lymph nodes, or thyroid, are also more likely to be cancerous. These areas are particularly sensitive and should be monitored closely for any changes. If you notice a new lump or thickening anywhere on your body, see your doctor. It's always better to be safe and get a professional opinion. Early detection is key when it comes to cancer. The sooner a potential issue is identified, the better the chances of successful treatment. Don't ignore a lump or thickening. Your health is too important to take chances. Regular self-examinations and being aware of your body can make a significant difference in catching issues early. Swallowing is something most of us take for granted, but when swallowing becomes difficult or painful, it can be a sign of something more serious, like cancer. Difficulty swallowing, also known as dysphagia, can manifest in various ways. You might feel like food is getting stuck in your throat or chest, or you might experience pain or a burning sensation when swallowing. Persistent or worsening difficulty swallowing should always be evaluated by a doctor. Difficulty swallowing can be a symptom of several types of cancer, including esophageal, throat, stomach, and lung cancer. Early detection is crucial when it comes to these cancers. Talk to your doctor about your symptoms. Most of us have moles or warts somewhere on our bodies, but sometimes these seemingly insignificant spots can undergo changes that signal something more serious: skin cancer. The ABCDE rule is a helpful guide for remembering the warning signs of melanoma. Pay attention to any moles or warts that exhibit asymmetry, irregular borders, multiple colors, large diameter, or evolving characteristics. If you notice any of these changes, see a dermatologist as soon as possible. Early detection is key when it comes to skin cancer. Don't ignore changes in your moles or warts. Schedule a checkup with your dermatologist today. So there you have it, 10 warning signs of cancer you should never ignore. Remember, knowledge is power, and by being aware of these signs and symptoms, you're taking a proactive step towards protecting your health. If you're experiencing any of the symptoms we discussed today, please don't panic, but don't ignore them either. Schedule an appointment with your doctor to discuss your concerns. Thanks for watching, and don't forget to subscribe for more videos on staying healthy.